Modern research suggests that cannabis is a valuable aid in the treatment of a wide range of clinical applications. These include pain relief, particularly neuropathic pain, nausea, spasticity, glaucoma, and movement disorders. Marijuana for the medical use should be legalized because it has many health benefits. WebMD states that medical marijuana uses the marijuana plant or chemicals in it to treat diseases or conditions. It's basically the same product as recreational marijuana, but it's taken for medical purposes. In my speech today, I will be discussing the benefits of medicinal marijuana and why it should be legalized. Research shows that cannabis has been around for centuries and is believed to have originated in Central Asia and expanded over time. The main reason people consume cannabis is because it makes them feel better. Cannabis receptors are present in the brain before they are born, and these compounds are even present in a mother's breast milk. One of the most well-known and obvious side effects of cannabis is experiencing the munchies, which in short means the extreme hunger that is felt after the experience. Studies have actually shown that it helps regulate appetite, which can be beneficial in eating disorders such as anorexia. Cannabis is also famously used to reduce the feeling of nausea, but studies suggest it could have a number of digestive benefits as well. Another ingredient present is THC, which can increase appetite and reduce nausea, according to drugabuse.gov. THC has been used on rats to kill off cancer cells, and when used in combination with radiation, it is very beneficial. Medical marijuana could play a role in a number of digestion-related health conditions, including Crohn's disease, obesity, and diabetes. Next, we will discuss the benefits of medicinal marijuana and pain management. Chronic pain is a common complaint that people have and is one of the most common reasons medicinal marijuana is prescribed to patients. A study published in the Spine Journal states that 1 in 5 patients at a spine center in Colorado where they were using cannabis to treat pain, it is said that 90% of those people said it relieved their pain either greatly or moderately. Another type of pain caused by diabetes is neuropathic pain, which is also treated with inhaled cannabis. Neuropathic pain can be debilitating and can severely impact quality of life, and there are currently a limited number of safe and effective treatment options for people experiencing pain caused by diabetes. The results of this study were astounding, and spontaneous pain over time decreases with each dose. Another health benefit of medical marijuana is with mental health. Some common misconceptions of medical marijuana is that it can trigger anxiety and speed up the onset of personality disorders that are genetically predisposed. Fortunately, this has yet to be proven by scientific research. Depression is also becoming more and more common, and studies show that medical marijuana helps with decreasing the negative stimuli in the brain. Depressed patients usually come in with a negative bias that is harmful to everyday life and functioning. THC has been shown to have an effect on the negative bias and has become useful in the treatment of depression. Schizophrenia is another chronic mental health disorder that has categories of both positive and negative symptoms. Positive symptoms include delusions and psychosis, while negative symptoms include a lack of emotion and inability to experience pleasure. While schizophrenia cannot be cured, a study has shown that cannabis offers improvement in sensory gating, which is the brain's ability to block out unnecessary information, according to medicaljane.com. Because of this, cognitive functioning was improved at a lower rate of cannabis intake. Another chronic disease that cannabis can be beneficial for is Alzheimer's disease. Scientists in San Diego have come out with evidence that cannabis and other chemicals in it can remove one of the most toxic proteins associated with Alzheimer's disease. This protein is called amyloid beta and is a major component in the plaque deposits that spread throughout the brain. In the study presented, it is shown that exposing the amyloid beta cells to THC reduced the protein levels, therefore eliminating the inflammatory response by the nerve cells. Alzheimer's disease is a progressive brain disorder that leads to memory loss and can seriously impair a person's ability to carry out daily tasks. With the use of medicinal marijuana, the effects of Alzheimer's can be decreased. Although there is still a lot of research needing to be done for legalizing medicinal marijuana, the current studies are enough to prove its benefits. The combination of THC and cannabidiol came together to produce a therapeutic effect, which is useful for many health conditions that I have previously discussed. If you are still unsure after this speech if medicinal marijuana should be legalized, visit www.medicaljane.com for multiple studies and statistics on the benefits. And I just want to show my 3 people on FaceTime.